Welcome to another edition of Talkline. I'm Zev Brenner, coming to you from the annual Prix Gallien Awards ceremony at the Museum of Natural History in New York City. The Gallien Foundation awards the best of science and medicine with an Academy Award setting here at the museum. And we'll present you with our very special broadcast right after these words from our sponsors. Stay tuned.
The Hebrew University of Jerusalem is a monument to more than 20 centuries of Jewish reverence for learning, to the Jewish quest for knowledge, as exemplified by its founders, who included Albert Einstein, Chaim Weizmann, and Sigmund Freud. Today, the Hebrew University has rewarded the vision of those founders. It's the top-ranked educational institution in Israel, and the leading developer of Israel's greatest asset, its brain power. Israel is a tiny country, smaller than New Jersey, with only 0.1% of the world's population and virtually no natural resources. However, in intellectual achievement, it has very few peers. Per capita, it has the highest ratio of university degrees in the world. It's first in the world in biotech startups and first in the number of scientific papers produced. This is Israel's brain power at work, and the leading generator of that brain power is the Hebrew University of Jerusalem.
Ow! Can you read my number?
Attention those on Medicare with diabetes. You may be eligible for an upgraded meter.
I am tired of stabbing my fingertips to test my blood glucose. There has got to be a better way.
If you're on Medicare with diabetes, then you need to know there's a new method for checking your blood glucose. You don't need to stab your fingertips anymore. This new Embrace meter is easier to use and nearly painless. And the best news is that Diabetes Care Club will send you one of these new meters.
This new method hurts less, and I don't have to stab my fingertips anymore.
Not only can I see my number, I can hear it too.
Your blood glucose reading is 89.
There's my number.
Find out why nearly 250,000 patients have joined Diabetes Care Club.
Call Diabetes Care Club.
Shipping is free, and so is the call.
Call 1-800-521-7697.
I'm glad I did.
Welcome back to the program. I'm Zev Brenner, coming to you from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
I'm particularly grateful to receive this award, and it is the beginning, I hope, of an emerging paradigm that enables all pharmaceutical companies to have access to 100% of the Earth's people, and in the process enables us all to work out arrangements that will keep us in the business that you got into in the first place and the one that I am now in, which is saving the largest number of lives we can with the time, with the knowledge, with the resources we have. That, to me, is the most meaningful thing of all this evening.
Health is at the center of our work at the United Nations, and it is at the heart of the world's efforts to achieve the Millennium Development Goals. This is the right event, on the right issue, at the right time.
We're speaking with Bernard Pousseau from France. He is a former chairman of Wyeth, which is a pharmaceutical company, and people look up to our guests, so good to have you.
It's good to see you. Thank you very much for having me.
Tell us about your company. I know it's a major one.
Well, you know, this evening is always a wonderful moment as it is about celebration of science, celebration of research, and celebration of wonderful molecules that saves people's lives. So I'm very excited about what's coming tonight.
Have you been here before?
Yes, many times. The Prix Gallien is a very international, renowned award in our world of science and research, and I think it's nice that those very distinguished scientists, many of them Nobel Prizes, take the time to analyze and scrutinize years of research and discovery and decide which drug or which molecule, vaccine, biotechnology drug gets an award.
I like to think of the Academy Award of those that are actually doing something very good to help mankind.
Yes, absolutely. And before the Prix Gallien, there was not such recognition for the thousands of scientists throughout the world in our labs, in the public and private sector who work daily to make advances like the one we will award tonight.
Thank you for sharing that with us.
Thank you very much.
Thank you. Peter Kim is president of Merck Research Laboratories, one of the sponsors of tonight's Prix Gallien Award ceremony. So good to have you.
Thank you.
How did your company get involved with the awards?
Oh, I think this is a really terrific thing. It's something that we've been participating in for years now. And what's really, I think, great is that it's so hard to make a drug or a vaccine that when you do succeed, you really should take the time to pause for at least a moment and celebrate, and that's what this is all about.
I think one of your colleagues told me in one of the sessions today that 80% of the drugs in research don't make it, only 20% do. That's a shocking number.
Yeah, it really depends where you look at it, but the success rate is very low. This is a very hard research endeavor that we're on, but it's so important because it's saving lives and it's improving the health of people. And so, really, it's just a tremendous thing to recognize the outstanding scientists and physicians that have put so much effort into developing these drugs and vaccines.
So when you have a home run, it should be celebrated.
Absolutely.
Thank you for being with us.
Thank you.
Glenn DeVries is president of Medidata, one of the sponsors of tonight's Prix Gallien's celebration and event here at the Museum of Natural History on the west side of Manhattan. Good to see you.
It's very nice to be here. We're very excited about the event. It's actually part of a whole fantastic day. So we spent the morning talking to a lot of people in industry, having some lively debate about the interaction of everybody in healthcare. And tonight we're going to celebrate some of the people who are really trying to push forward our industry to the greatest extent possible. So it's
to make a difference for mankind, right?
Well, that's a nice thing actually about working in healthcare. You get to go home every day knowing that you're doing good things, hopefully for your children, your parents, one day maybe yourself, and it's kind of something that we really like to think about at Medidata Solutions. We actually work on software. We help create infrastructure for life sciences companies to run clinical trials. But at the end of the day, what we're really doing is bringing life-enhancing and life-saving therapies to market that much faster. And it's a great thing to do with your life.
How fast can you get something to the market?
Well, actually, it's a really interesting question. And one of the issues in life sciences is that when you discover a new drug, you have to spend a lot of time testing it, making sure it really is safe and effective, getting the right claims on the label. And it's something that can quite literally take a decade or more. So one of the things that we're trying to do, again, as an industry, looking at the way pharmaceutical companies and payers and doctors and nurses are thinking about working with patients is, what can we do to identify people who are really fantastic targets for new therapies in a much more directed way, find them very quickly, and make sure that we get new medicines into their hands to the extent that we can extend or enhance their lives in a way that provides real value. If we can successfully do that in ways that have been done in the past, we can really start to realize the dream of what people talk about in personalized medicine. You take the words personalized and medicine, those are two things that people don't
always go together, right?
Nobody's really successfully made either one of those scale. So if we as an industry can really make those two ideas work together, again, I think we're creating a better world for everyone, everyone's parents and everyone's children.
Wonderful, and as I'm listening to you, you have a great broadcast voice in case you want to add another career aside to your busy schedule.
Backup, I guess, yeah.
A backup, just in case.
Well, it's really nice to talk to you. Thanks so much.
Pleasure, thank you.
Thanks.
Rabbi Joshua Zurn, Executive Director of Madregos, Jewish organization, and he's here tonight, so welcome. Tell us about Madregos.
Well, just a little bit about Medragos. We work with teens in the Five Towns community. We have an office also in Chicago. We work throughout the Northeast and the Midwest, working with teens in preventative care and working with the teens at risk community as well.
How'd you end up here tonight at this very special ceremony, the Prix Gallien, which is the Academy Awards of those that are in the health sciences and contributing to mankind?
Well, Gilles Gade of Cross River Bank, that Medragos enjoys a very close relationship with Cross River Bank. They just sponsored an event for us, a golf outing that was hugely successful, a sold-out event, and the benefits went to Medragos. Gilles asked if I could attend the evening, and it's an honor to be here, and it's an honor to meet Eli Wiesel tonight. And thank you very much, I guess.
Thank you. Good to see you. We'll be right back with our very special broadcast originating from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
Are you in business? A store owner, wholesaler, or manufacturer? Do you know you may be eligible for free television and radio advertising? Millions of dollars are lost every year by businesses not taking advantage of free radio and television advertising. Don't lose out. Advertising is the lifeline of any business, large or small. For free consultation, call us in the New York area 212-769-1925. Out of New York, 866 My TV Show.
If you have diabetes and love food, pay attention to this free offer.
Hi, I'm Nicole Johnson, Miss America 1999. I've had diabetes since 1993, and I hate boring food. Well, I got these 3 free cookbooks with fantastic tasting recipes for people with diabetes. If you have diabetes and have Medicare, you can get these cookbooks free.
Call now to qualify for not 1, not 2, but 3 free cookbooks. Call 1-800-753-6314.
You'll love this rich chocolate cake, oven-fried chicken, and nachos. You'll also get this free meal planning guide and diabetes magazine. So call now for your free Better Care Kit with 3 free cookbooks.
To qualify, call 1-800-753-6314. That's 1-800-753-6314.
If you've ever considered hosting your own radio or TV show, then we can help you. Talkline Communications works with individuals and groups interested in broadcasting on radio and TV. Ideal for lawyers, doctors, financial advisors, organizations, or anyone interested in broadcasting. Talkline works with various TV and radio stations in New York and around the country that lease airtime at competitive rates so we can pass on that savings to you. For more information, call us at 212-769-1925. That's 212-769-1925.
Welcome back to the program. I'm Zev Brenner, coming to you from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
On behalf of the 1,100 member organizations of the Biotechnology Industry Organization, I extend my greetings and best wishes to all who are gathered to celebrate the 2011 Prix Gallien USA. I'm particularly delighted to see so many of our member companies as final candidates for the Prix Gallien 2011 awards. These companies, like the tens of thousands of biotech enterprises around the world, work hard each and every day to meet the goals so well articulated by Prix Gallien, to develop innovations to improve the human condition. From large multinational corporations to the single researcher diligently working to unlock the secrets of cellular and biomolecular processes, our members are dedicated to the noble task of developing technologies and products that help improve our lives and the health of our planet. We salute the Prix Gallien for honoring this dedication by rewarding excellence and novelty in our field and for recognizing those who have leveraged technological breakthroughs to serve humanity at large.
Oracle is deeply committed to establishing a more personalized, value-based healthcare system that really leverages the research and development that's provided by the people in this room tonight. We spend over $4 billion a year in research and development. That's not including the many acquisitions we also make, in a similar belief that by investing in the expertise, innovation, and creativity of our employees, we can help make the world a better place and improve human health. Much like last year, we described how we continue to try to provide the kind of infrastructure that's important to you in this room. Over the last year, having seen tremendous growth with over 5,000 clinical trials, we're now managing the back end and IT infrastructure for many of you here today. This morning, we sort of kept up with the tradition of making announcements here at the Prix Gallien event over at the Alexandria Center. We announced the beginning of the Oracle Translational Research Center, an IT platform that facilitates the secondary use of medical data across clinical and research organizations. It allows users to normalize, aggregate, and analyze data from internal and external sources to identify new predictive biomarkers, treatment best practices, and more effective therapies for individuals. The use of this type of platform, we believe, will help move everyone in this room, the patients and others and families that are involved in taking the benefit of what you create, move us towards the goal of personalized health care, and really represents the continued evolution of how we can provide a more personalized and cost-effective healthcare system.
Neil DiCrescenzo is the Senior Vice President of Oracle Health Sciences. This is the third year that he's sponsoring the Prix Gallien Awards here at the Museum of Natural History. Good to see you.
Thank you, Zev. Good to see you.
So how did you get involved with this prestigious award ceremony?
Well, Oracle is one of the largest providers of information technology for clinical development and research. And really, it's an opportunity for us to celebrate with the industry the achievements of all the researchers, clinicians, and people that bring great treatments to market.
What I like about it, and I know you're a major sponsor of tonight's event, what I like about this particular event is you have so many people in the sciences and medicine, the pharmaceutical companies, investors, and really what they're doing is contributing to the health of mankind.
Yes, I think it's a great opportunity to step back for a moment and realize, as much as there are always challenges and issues in any industry, the amount of opportunity for improving human health that many of the people in this room have contributed to is really tremendous.
Tell us more about your company for those that may not be familiar with Oracle.
Well, Oracle is the largest enterprise software and systems vendor in the world, over $30 billion in revenue. We're the largest provider of solutions for this space around clinical development and healthcare. So this is a great opportunity for us to bring our information technology acumen to really helping improve human health.
Before I let you go, what's the next big item that's going to be out there that your company is producing?
Well, I think we're actually announcing tonight our Translational Research Center, which is an opportunity to really create a platform for biomarker identification and aggregating and normalizing data, which is very important to most of the people in this room.
Congratulations, and look forward to learning more about that.
Great, thanks, Zev.
Thank you.
Thank you.
On my right, originally from France, Donnie Strasbourg, his wife Elaine on my left. Donnie is with the Scripps Research Institute, and Elaine has written books about medicine and art. And welcome both of you, and I know that you probably know about this very special event. The Prix Gallien is famous in France.
Yes, very much so. The Prix Gallien was actually started by a French couple, Gallien, and now they made the Prix Gallien, and it's every year, so a prize is given in France and also international. This is the international prize. There's a very prestigious committee, scientific committee. Many of my friends are on it. And I'm very much involved with biotechnology and pharmaceutical industry, as is my wife, or was my wife. So we are very much involved in this area, and we want to be here. This is a very big event every year.
And your friend Bruno Cohen is the organizer, right?
Correct. Bruno Cohen is one of our very good friends. He's a friend of my son, Serge, who's an artist who lives in New York, and who will be here tonight later. And so we are all here with friends, but also colleagues. So it's a really good mixture of friends and colleagues, a very high level of science and research and drug development.
Tell us about your book. Your book was published by UNESCO, I believe.
Right. I wrote several books, but one of the books I wrote was published by UNESCO. It was about art and science, and it was basically a program, an educational program that we developed internationally. So it was translated into an electronic program so that people in countries such as Brazil or Africa, where it's very hard to get books, could get that information and participate in classes about art and science.
What's your next book going to be about?
The next book is going to be about the various roles of art in human life at different stages of human life.
We look forward to seeing that. Thank you for joining us.
My pleasure. It's a
Thank you.
pleasure to be here.
Thank you. Dr. Samuel Waxman is a distinguished professor of medicine at Mount Sinai who also specializes in cancer research. And good to see you at the grand prize. This is the big event, the Prix Gallien Award ceremony.
Oh, it's great to be here. In particular, I think it's so appropriate that Paul Farmer get this recognition from Elie Wiesel. I think the combination is quite extraordinary. Both of them are great humanitarians and have dedicated their lives to really helping very meaningful causes. And so I'm delighted to be here.
And I'm sure you've been at past events as well, correct?
Actually, this is my first one.
Oh, your first one?
Yep, and I'm not exactly sure what the format will be, but I was intrigued to come on an invitation because of Paul Farmer. I think that's the main reason I'm here, and I think it's a great recognition for him.
We appreciate you sharing that with us.
Pardon me?
We appreciate you sharing that with us.
My pleasure, and thank you for having me talk with you.
Okay, thank you.
Right.
We'll be right back with our very special broadcast originating from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
You won't find someone who loves Sharf Satardavot more than me. The staff here is wonderful. They treat him like a friend. Mr. and Mrs. Sharf have helped me so many times. Anytime I had a question, they were like the first people I would call, and it was like calling, you know, a good friend that gave you advice from the heart.
As soon as I walked into Sharf Satardavot, I said, this is it for my mother. Everybody was so lovely and warm, and there were so many activities, and I saw this atmosphere, this ambience immediately.
Everybody and anybody in the neighborhood walks in all the time to visit, to cheer up the people, to have nachas, to see a place run so well.
A lot of people don't know this about my mother. She ran facilities in Ohio for senior citizens. I think that this is God rewarding her now, being in a place where she's having such good care.
My parents really needed someone to give them the love that this place was able to give them.
Can you read my number? Attention those on Medicare with diabetes. You may be eligible for an upgraded meter.
I am tired of stabbing my fingertips to test my blood glucose. There has got to be a better way.
If you're on Medicare with diabetes, then you need to know there's a new method for checking your blood glucose. You don't need to stab your fingertips anymore. This new Embrace meter is easier to use and nearly painless. And the best news is that Diabetes Care Club will send you one of these new meters.
This new method hurts less, and I don't have to stab my fingertips anymore.
Not only can I see my number, I can hear it too.
Your blood glucose reading is 89.
There's my number.
Find out why nearly 250,000 patients have joined Diabetes Care Club.
Call Diabetes Care Club.
Shipping is free, and so is the call.
Call 1-800-521-7697.
I'm glad I did.
Welcome back to the program. I'm Zev Brenner, coming to you from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
Good evening. The discovery and development of a product as innovative and transformational as Stelara requires the drive, determination, vision, and perseverance of hundreds of individuals over many years. Tonight's award reflects a convergence of their pioneering work in science, in technology, and in medicine. It is both quite humbling and a great honor to stand before you representing the extraordinary team responsible for Stelara. And amazing as Stelara has proven to be in the treatment of patients with psoriasis, the journey of discovery and innovation is far from over. The Stelara team is at work now exploring its potential in several additional diseases and exploring the potential of new therapeutics that build on the science behind Stelara.
We're speaking to the winner of the Biotech Award, Dr. Jay Siegel. He's the Chief Biotechnology Officer of Janssen. That's of J&J, Johnson & Johnson, and I think they've amalgamated a lot of the companies. But first of all, congratulations on your win tonight.
Thank you very much. It's a great
Expect to win the Prix Gallien Award tonight?
And of course, let me say, I didn't win the award. The award was for Stelara and reflects the work of many scientists who did. And, well, we were hopeful, but of course there's an awful lot of outstanding drugs in the competition here tonight. So we're very pleased and honored to be recipients.
So tell us about the drug that won the award and which you're accepting the award on behalf. So I consider you the awardee as well. But tell us about it, what it does.
Sure. Stelara is a monoclonal antibody, so it's like the antibodies in the body, except using genetic cloning technology, we're able to make large numbers of identical antibodies. Each dose and each one contains large numbers of identical antibodies. And it's an antibody to a new target that hasn't been used in medicine before because it's only recently understood its role in various diseases. In fact, it's still being understood, and that's interleukin-12 and interleukin-23. These are two proteins that are natural to the body and that convey signals within the immune system. And there are some of the signals that they convey are part of the disease process in psoriasis. They're also part of the disease process in a number of other diseases, and we're very excited about ongoing studies looking at the use of Stelara in a variety of other diseases. But the first one that we have studied is psoriasis, and in that, Stelara, which is an injectable product, it can be self-injected with an auto-injector. After 2 initial doses, it's once every 3 months, so it's a very easy to take, well-tolerated drug, and it causes complete or near complete clearing in the of psoriasis lesions in the large majority of patients who take it. And that's
a lot of people can be helped by that.
A lot of people can be, and psoriasis can be quite a debilitating disease. It can prevent people from working. It can significantly impair social life. A lot of people with psoriasis don't get married or are embarrassed to be in public because although some people may know of patients with or individuals with very mild cases of psoriasis, when this disease gets severe, it can involve large portions of the total body skin and be quite difficult to deal with and quite disturbing to the quality of life of patients who suffer from it.
Any idea how many numbers of patients that suffer from that in the United States?
I know that the people in our company have a very good idea of that, but I would be probably recalling wrong if I tried to give you a number. I think we're on the order of a couple percent of the population, though. It's not that rare. A couple percent have psoriasis at some level, but this drug is really for those who have moderate or severe psoriasis.
Sounds like a lot of people are going to be helped, and it's relatively painless from what you're saying, and it can be almost immediate relief. How long did it take to develop?
Well, developed. So the first human study started in either 2002, 2003. The work in discovering it started a few years before that, so in the late 1990s. And it was first approved by the US FDA in 2009, so on the order of 10 years or so.
Which is how long it takes, 10 to 15 years on average to get a drug out to the market.
It was actually maybe a few months to a year ahead of average for its class of drugs.
Anyway, thank you and congratulations on behalf of J&J Johnson & Johnson and all the amalgamated companies, right? How many companies? What is it? Janssen is the new name for it, correct?
Right. We're all using the name Janssen to reflect the fact that we're one family of companies that work together as one team toward addressing medical needs.
Thank you.
Thank you.
Ken Fraser, the president of Merck USA, and he's a major sponsor. You're a major sponsor of the Prix Gallien Awards, so thank you for joining us.
Thank you for having me.
Tell us how you got involved with the Prix Gallien Foundation.
Well, you know, Merck as a company has as its central reason for existing scientific innovation, translating science into medically important products. So it's a natural for us to support the Prix Gallien since it celebrates exactly that.
Well, it's nice to see because a lot of companies are into profits, and I'm noticing tonight and a lot of the pharmaceutical companies and other companies that are here are looking to give back as well.
Well, our reason for existing, really, our mission is to have those products make an impact on humanity. And so while we obviously have to continue to think about making enough profit to continue our research, our main reason is to serve humanity.
One of the things that I was impressed by the conference today and also tonight is that I believe it's 90% of product or 80% of products that you do investigations for and research don't make it. Less than 10% actually do, which is a shocking number, which would understand why it costs so much to bring a product to the market.
Yeah, I think the public doesn't understand the huge risk and the lengthy and costly process of discovering and developing a drug.
About 10 to 15 years, right?
Absolutely.
Any way to cut that in half or less?
Well, they're always investigating new ways, biomarkers and things of that nature that may help, but it's still always going to be a long and costly and risky proposition.
Thank you for joining us.
Thank you for having me. Take care.
Okay, thank you.
Bye-bye.
We'll be right back with our very special broadcast originating from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
Are you stressed over credit cards and other debts, maybe through no fault of your own? Imagine how it would feel to have that weight lifted right off your shoulders. Well, here's some good news from America's trusted name in debt relief. Care One providers have already helped over 4.5 million people in debt, and we can help you today. Just call this toll-free number to speak with a friendly representative, and in just minutes, you'll get your free debt relief analysis.
Just call the toll-free number today.
Is getting a good night's sleep getting impossible? Well, not anymore. Introducing Side Sleeper Pro. It's much more than a good night's sleep. The secret is Side Sleeper Pro's doctor-developed ergonomic patented design to help support the neck and spine. Here's how it works. Watch as Side Sleeper Pro guides your head, neck, and vertebrae into natural alignment, relieving pressure on the neck while unrestricting airways. The tail cradles your back to ensure correct posture. Now, you can wake with less stiffness and feel rested thanks to improved sleep posture. Side Sleeper Pro is only $39.99 and it's guaranteed to work. But wait, order right now and we'll cut the price to $19.99. Plus, order now and we'll include a washable cotton pillowcase for free. Order online at sidesleeperpro.com. And we'll include an inflatable travel pillow, perfect for when you're on the go. For only $19.99, you'll get the Side Sleeper Pro pillowcase and travel pillow, a $100 value. But you must order now.
Hello, my name is Tova Feldshuh, and I've played many roles in my career, including Prime Minister Golda Meir. Like you, I've watched the news and felt helpless as the Katyusha rockets brought death and destruction to Israel's north. Rockets being launched from Gaza also threaten Israeli communities, but there is something we can do. Make a contribution today to American Friends of Magan David Adom Code Red Emergency Campaign. Go to www.afmda.org and help save lives in Israel.
Agent MS is the great new video series for Jewish kids that educates while it entertains. Shimmy Epstein is a typical yeshiva boy, but when the forces of evil strike, led by their fiendish leader, Dr. Lotov, Shimmy transforms into the awesome Agent MS. The Forward recommends Agent MS as a perfect gift, reporting that in their experience, kids just eat it up. Agent MS is now out in 3 great episodes. Find it in your local Judaica store, or check out their website at agent-ms.com, or call 1-888-MS-123.
Welcome back to the program. I'm Zev Brenner, coming to you from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
It is with considerable humility that I stand here today representing my Pfizer colleagues and all of the investigators who, over the years, have worked to make Prevnar 13 a reality. You know, the pneumococcal organism was first recognized about 130 years ago, actually. And in the early parts of the 20th century, the pneumococcal organism, actually, as many of you know, played a significant role in the biomedical research of that era. But the pneumococcus is also a cause of very significant morbidity and mortality. Pneumococcal disease is today considered one of the most significant causes of childhood death around the world. And it is when the precursor to Prevnar 13, the earlier vaccine known as Prevnar, was first introduced over a decade ago, it represented what at that time was an incredible technological advancement. the ability to render the polysaccharide capsule of the bacterial organism immunogenic so that it could in fact elicit an active and effective immune response in infants and in children. In those countries that introduced Prevnar back then, almost 12 years ago, in fact, those countries have experienced a almost amazing substantial decline in pneumococcal disease caused by the seven serotypes that were in that vaccine. But as I mentioned a moment ago, in spite of that success, pneumococcal disease remains the largest cause of vaccine-preventable death in children worldwide. So it became quite evident some years ago that a second-generation vaccine was necessary. That became Prevnar 13. It was important to add additional serotypes, not only to cover additional serotypes that were responsible for pneumococcal disease in developed countries, but particularly in developing countries as well. And as Professor Samuelson mentioned, it also became clear that given the importance of the disease and given the extraordinary efficacy of the vaccine, that it was necessary to develop new technological methods to assure the production of the tens of millions of doses, in fact, the hundreds of millions of doses that are required every year in order to make this vaccine available to the world's children. The development of this technology is actually all the more remarkable because, in fact, Prevnar 13 is arguably one of the most complex, if not the most complex, biological product currently in production. And as all of my colleagues at Pfizer know, that the development of such a product, in fact, represents a considerable degree of organizational commitment and personal dedication.
Accepting the award on behalf of Pfizer, I feel like I'm at the Academy Awards, but the Prix Gallien is certainly just as prestigious as the Academy Awards. It's helping companies are helping save lives. And Dr. Emilio Amini accepting the award for Pfizer is Chief Scientific Officer for vaccine research at Pfizer. So congratulations on your company's winning an award tonight.
Thank you. Thank you very much.
Tell us about the product that you won.
Well, the award was given for Prevnar 13, which is a vaccine to prevent pneumococcal disease. As the name of the vaccine implies, to prevent pneumococcal disease caused by 13 serotypes of the pneumococcal organism that are most responsible for the severest pneumococcal disease seen in children.
And how many people will be helped by this vaccine?
Well, you know, pneumococcal disease is the world's largest cause of vaccine-preventable death in children worldwide. So you can imagine that we're talking literally hundreds of millions of children. And the vaccine was specifically designed to contain both serotypes and to be produced in such a way that we could make available literally the hundreds of millions of doses of vaccine required every year to immunize the world's children.
I know it takes about 10 to 15 years on average from when the idea percolates in the laboratory until it gets to the market, until the consumer can actually get it. I'm curious, what is the financial cost for those 15 years to research such a product and bring it out? And I guess you have many other products that don't even make it that far.
Well, you can imagine it's considerable, right? It's 10 to 15 years is about exactly what it took here, about 10 years worth of research on Prevnar 13, built on another 10 to 15 years worth of research on an earlier version of the vaccine. And the investments are considerable. But it's not just financial investment, it's also the investment of dedication and intellect and technology. But in the end, it's all worthwhile.
You save lives, but you got to have perseverance. If it's 15 years and you said it's on research on another product, it could have been 10 or 15 years before, and that's a pretty long time.
Yeah, but the goal is what makes it worth it, right? And as I said in my acceptance talk, it represents a considerable organizational commitment and an incredible amount of individual dedication by all the people involved in doing this.
Absolutely, and that's why kudos to you and Pfizer, and congratulations on a product that's going to make a difference.
Thank you very much.
We'll be right back with our very special broadcast originating from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
You won't find someone who loves Sharif Sataritavot more than me. The staff here is wonderful. They treat him like a friend. Mr. and Mrs. Sharif have helped me so many times. Anytime I had a question, they were like the first people I would call, and it was like calling, a good friend that gave you advice from the heart.
As soon as I walked into Sharif Sataritavot, I said, this is it for my mother. Everybody was so lovely and warm, and there were so many activities, and I saw this atmosphere, this ambience immediately.
Everybody and anybody in the neighborhood walks in all the time to visit, to cheer up the people, to have nachas, to see a place run so well.
A lot of people don't know this about my mother. She ran facilities in Ohio for senior citizens. I think that this is God rewarding her now, being in a place where she's having such good care.
My parents really needed someone to give them the love that this place was able to give them.
Ow!
Can you read my number? Attention those on Medicare with diabetes. You may be eligible for an upgraded meter.
I am tired of stabbing my fingertips to test my blood glucose. There has got to be a better way.
If you're on Medicare with diabetes, then you need to know there's a new method for checking your blood glucose. You don't need to stab your fingertips anymore. This new Embrace meter is easier to use and nearly painless. And the best news is that Diabetes Care Club will send you one of these new meters.
This new method hurts less, and I don't have to stab my fingertips anymore.
Not only can I see my number, I can hear it too.
Your blood glucose reading is 89.
There's my number.
Find out why nearly 250,000 patients have joined Diabetes Care Club.
Call Diabetes Care Club.
Shipping is free, and so is the call.
Call 1-800-521-7697.
I'm glad I did.
Welcome back to the program. I'm Zev Brenner, coming to you from the Prix Gallien Awards ceremony at the Museum of Natural History in New York City.
Postmenopausal osteoporosis is a grievous condition. 1 in 2 women over 50 will face a fracture in their lifetimes. Fractures in and of themselves are painful and limiting, but more importantly, they put the patient at risk for subsequent fractures, and indeed the most grievous fractures can contribute to the demise of a patient. Prolia is now available to address this grievous condition. Just a week ago, we were approved for the treatment using Prolia of cancer treatment-induced bone loss. This is the circumstance where bone mineral density is lost as a consequence of either anti-androgen or anti-estrogen therapy in patients with prostate and breast cancer.
Dr. Roy Baines joins us, Director, Vice President, Global Development for Amgen, and his company won the award tonight for biotech, the very prestigious Prix Gallien Awards. So congratulations on behalf of your company.
Thank you very much.
Tell us about your product.
So Prolia and Xgeva are products that really are the trade names for molecule denosumab. This was developed to specifically inhibit a pathway which is critical in bone destruction. Consequently, we have developed this drug to treat patients with postmenopausal osteoporosis, and in that form the drug is used under the name Prolia. It also has been developed to prevent skeletal complications of patients who have metastasis of cancer to bone, and in that form it's known as Xgeva.
What challenge did you have bringing it to market?
This is a quintessential story of following the science. The pathway was discovered and fully characterized by scientists at Amgen. We were able to use this to develop and discover, innovate, and develop these two agents. They're both denosumab, just used in different doses. And in fact, really, the time horizon was one of 15 years. So I would say the major challenge is really having to just basically work through all the steps of drug development to get it right. I think it demonstrates that when innovation is performed, one has to commit to the long-term time horizon to bring the drugs to market.
Would you like to see that changed or shortened?
I think you've got to do it right. So I think getting the science right, doing the right clinical trials, and bringing forward an evidentiary package that meets regulatory requirements is how it should be done.
What about other countries? Does that also take as long, let's say in Europe, to get the drugs out to the market from the development to store?
I think doing good science takes time.
Thank you and congratulations again.
Thank you so much.
So I'd like to take this opportunity to wish Dr. Farmer my heartiest congratulations for
for receiving this year's prestigious Pro Bono Humanum Award, presented by the one and only Elie Wiesel. This is a tremendous and well-deserved honor, and he is in good company as he joins a roster of past winners that includes some of the world's foremost leaders, scientists, and humanitarians. I'd also like to congratulate all the candidates for the 5th annual Prix Gallien Awards competition, which honors those in the pharmaceutical industry who have developed the technical, scientific, and clinical research skills necessary to develop innovative medicines and devices. Your work is invaluable. As FDA Commissioner, I have a profound appreciation for the importance of science in the service of health, and how the advancement of science, specifically regulatory science, the science needed to assess and evaluate a product's safety, efficacy, quality, and performance, is fundamental to progress in medicine and public health. This is a critical moment for our world. The pace of biomedical discovery continues to accelerate, and the stakes have never been higher. But we, as a scientific community, must do a better job of translating these scientific discoveries into innovative therapies for the people who need them most. And it's gatherings like this that will help make that possible.
Paul, you have been a teacher to teachers, and you have been a benefactor to those who need help. You have devoted your life to come to the rescue of many men and women and children in very powerfully appealing situations. You went wherever you were needed. And when I think of you, I see in you not only a great scholar, a great medical authority, I see in you also a colleague, a writer. And for all the words that you have written and all the deeds that you have done for so many people, it is my great joy and pride to give you the Prix Gallien Award this year.
The complexities of medical care and public health are great. We all know that. What we really do, however, is to apply the fruits of basic science. As Professor Weissman said, that's what we do in our work. Partners in Health is, as John David has noted, it's a medical charity. We run now 70 hospitals. We serve millions of patients. And they're almost all in places that are too rarely reached by the fruits of science and medicine, like rural regions in Rwanda and Malawi, Lesotho, Burundi, but also rural Haiti. We also have programs, I hasten to add, in the shadow of Harvard's great teaching hospitals, in Roxbury and Dorchester, and in the Navajo Nation. And in each of these instances, that's what we're trying to do, to take the lessons of science and the fruits of science and technology and apply them. And to do that, of course, we need deliverables, to use a word. I'm almost certain that President Clinton must have used this word when he was here last year. And what he means by that, as he said, is preventives, diagnostics, therapeutics. The work that he has done, and we've also worked with him a great deal, especially in Africa and in Haiti, is to champion the equitable use of these great tools to save lives. We are anxious to continue our work to deliver the fruits of science and technology to people who need it most. And to do that, we're going to require a great deal of support, to use the term that was mentioned earlier tonight, platforms, really, of improving delivery of healthcare services. And it won't just be in Haiti, but also in this country and in many others. And I'm so grateful that you've chosen to elevate our work with Partners in Health, also our work teaching doctors and nurses and community health workers in more than a dozen countries.
Dr. Paul Farmer won the humanitarian, actually the Pro Bono Award from the Prix Gallien Foundation for his work throughout the world, including Haiti. Millions of people have been helped by him. Or should I say you got the Emmys tonight? Because I know you made a funny reference about that.
I did make an error complimenting some friends in a rock band for their Emmy. It was a Grammy. In any case, they forgave me. So, but this is a great honor to be here and have this work, which is the work of many thousands of people, but it's a very great honor to have it recognized.
You were in Rwanda, Haiti, many other parts of the world. Tell us some of the work that you've done. I know you've touched millions of people.
Well, Partners in Health is a partnership organization. I'm actually a medical school professor at Harvard and a volunteer for Partners in Health, as are many of the physicians, American physicians working in Haiti, Rwanda. Our job really is to create local capacity, to build, to help engage local physicians and nurses and health workers in this work to serve the underserved.
What went through your mind because you got the prestigious award? It is like winning an Emmy or the Academy Award. So certainly this is a great honor that was bestowed on you by the Prix Gallien Foundation, which is a preeminent group bestowing honor on those that make a difference in humanity. And certainly you're making a big difference, and I think you probably want to have people emulate you as well.
Well, I mean, that's the great thing about being a teacher is, you know, you're also training the next generation. So I'm absolutely sure that each year more and more people become interested in what some people are calling global health, but really is their health disparities. How can we bring the fruits of science and technology to bear on the health problems of people living in poverty, whether in the United States or anywhere else?
You saw the poverty in Haiti. You were able to bring down the price of drugs by over 90%.
Well, again, this is all coalition work that involves huge numbers of policymakers, pharmaceutical providers, and groups like the Clinton Foundation with which we've been working for many years.
Being modest, because it certainly takes a catalyst to make sure that everything happens. So I want to congratulate you. May you continue with God's strength to do so much more good work for humanity, for all of us. And congratulations on the Emmy Award. I mean the Prix Gallien Award tonight.
Thank you very much.
We'll be right back with our very special broadcast originating from the Prix Gallien Award ceremony at the Museum of Natural History in New York City.
Holly's discovered a secret that could help thousands of other catheter users.
For years, I never realized how different catheter supplies really were.
Like thousands of Liberator customers nationwide, Holly discovered the big difference Liberator makes with a wide range of personal services, unlike other catheter suppliers.
Liberator Medical saves you money.
Liberator contacted my doctor and made arrangements for me to try catheters that were easier to use, much more comfortable, all for free. And they helped me qualify for a new sterile catheter every time I needed one. No more reusing.
We work with your doctor, insurance, and Medicare. We handle all the paperwork and billing. There's free shipping for little or no out-of-pocket costs.
If you or someone you care for uses catheters, call today. See what makes Liberator so different and for little or no out-of-pocket costs.
The minute you make the phone call, you're going to see the difference.
Call 1-800-628-2454. 1-800-628-2454.
Kosher Expeditions provides unique activity-based tour vacations with delicious glatt kosher cuisine, cooked fresh on site to over 30 of the world's most exotic destinations, including Costa Rica, the Canadian Rockies, Spain, and African safari. Relax at our 7-year running Passover holiday adventure located at our Kosher Le Pesach luxury beachside resort in Costa Rica. Enjoy breathtaking ocean views surrounded by exotic wildlife on an all-inclusive Pesach vacation that includes inspiring lectures, children's programming, and exciting Costa Rican adventure tours during Chol Hamoed. Kosher Expeditions operates year-round tours, offering all-inclusive travel programs to custom and private groups, students, camps, young adults, and regularly scheduled departures. Come tour with the most established kosher tour operator since 1994. Call Kosher Expeditions at 877-JT-KOSHER or visit them online at kosherexpeditions.com, the source for exciting worldwide kosher adventure.
Are you stressed over credit cards and other debts, maybe through no fault of your own? Imagine how it would feel to have that weight lifted right off your shoulders. Well, here's some good news from America's trusted name in debt relief. Care One providers have already helped over 4.5 million people in debt, and we can help you today. Just call this toll-free number to speak with a friendly representative, and in just minutes, you'll get your free debt relief analysis.
Just call the toll-free number today.
Are you in business, a store owner, wholesaler, or manufacturer? Do you know you may be eligible for free television and radio advertising Millions of dollars are lost every year by businesses not taking advantage of free radio and television advertising. Don't lose out. Advertising is the lifeline of any business, large or small. For free consultation, call us in the New York area, 212-769-1925. Out of New York, 866 My TV Show.
We hope you've enjoyed our very special broadcast originating from the Prix Gallien ceremony at the Museum of Natural History of New York, awarding the finest of what mankind has to offer in the fields of science and medicine and pharmaceutical products. For more information about the work of the Gallien Foundation, you can contact them at the address and phone number you see on screen. Thank you for joining us once again here on the Talkline Communications Network. I'm Zev Brenner. Shalom.
Thank you for watching Talkline with Zev Brenner, America's #1 Jewish program. If you have any comments or would like more information on all of Talkline's radio and television programs nationwide, contact the Talkline Communications Network at Post Office Box 20108, Park West Station, New York, New York 10025, or call 212-769-1925. Out of New York, call 1-800-628-TALK. That's TALK. This is the Talkline Communications Network.